Kenya, and I suppose Africa as a whole, is a country of paradoxes. You know, you find some very developed pockets of the country, and within a few kilometers, 1 or 2 kilometers, you find, you are thrown back into history. Well, my training is as a medical doctor, but I think even before I started clinical practice, I've always had a soft spot for working for the areas with difficult access to health.
We have a footprint in 5 countries. In Africa, we are in Kenya, South Sudan, and Zambia. And in the Caribbean context, we are in Peru.
So in Kenya, we work in 11 counties. And in these 11 counties, our work is composed of maternal child health, HIV, malaria, tuberculosis, and cervical cancer, and water and sanitation. Unfortunately, in the countryside where a majority of the people live, there is difficult access to health services. These difficulties occur as a result of shortage of doctors, shortage of nurses, equipment, and so on.
We are working with AI avatars to collect and aggregate health information.
Hello, I'm Fotel's digital assistant.
We can ask questions in any language and be any ethnicity.
So instead of talking to one person, you can be talking to thousands.
In Kitui County, CMMB is using artificial intelligence and digital avatars in order to capture patient information. This patient information includes the quality of services, the effectiveness of services that they are getting, their satisfaction, and what more can be done to make health service delivery better. We have set up these avatars in 25 of the health centers where we are working.
We started on laptops and then moved quickly to sending the avatar to mobiles. So when the avatar asked questions like,
are there any groups in your catchment area that resist screening and HPV vaccination services?
the head of facility could say,
yeah, in our catchment population, we still have a group that resist the vaccination. So it has become a challenge, we as healthcare workers, to give this vaccination.
We also ask patients questions in their native language, Kamba.
Ethwa na ivinda ianite na ndakitali ya kumunenge mabata maku na niwe ane wanundu makulyo maku masungiwa
nethwa na ivinda ya kwa ndakitali nani wa makulyo maku ala nakulya.
After using the avatar to collect the data, we used artificial intelligence to analyze and write the reports. This means that we could quickly understand what was happening on the ground and drive better health outcomes for our patients.
We were instantly interested and intrigued by some of the innovation ideas that Fotel had, because one of the things is that we realized that technology is one thing that we can use to leapfrog many infrastructural information and communication gaps. The fact that we can have an avatar that will that people can interact with, and we can know, we can collect information on how the health services, the health services that they received. We can collect information on attitudes. We can collect information on how they want to be attended to. For us, it was a no-brainer.
We are very excited about the possibilities that artificial intelligence brings to drive better health outcomes for communities living in rural areas.